Hello, everyone, and welcome to this Tuesday talk. My name is Chaney, your gracious host for this amazing event. I have my friend Doug joining me. Why don't you, if you would please, introduce yourself to our listeners, Doug? This is not the first time you and I have done this webinar before. Introduce yourself, your name, your title, how long you've been with Right at Home, and a little bit about what your title means.
Great. Thanks, Jen. Yeah, I'm Doug Robertson, and I'm the Senior Director of Government Affairs here at Right at Home Corporate, headquartered in Omaha, Nebraska, and grateful to be with the organization now for over 10 years. And I have been engaged in government relations work on behalf of food, beverage, consumer product companies, as well as home care agencies now for over 25 years at the state and federal level, and thoroughly enjoy helping business owners understand how to navigate contract work. And in the home care sphere, that includes getting contracts with the U.S. Department of Veteran Affairs and their PPAs or third-party administrators, acquiring a home care license. We provide that support through a vendor that we work closely with, and also providing some expertise with Medicaid in the states where that makes sense, and also the new guide Medicare benefit for those with dementia, which is growing in popularity. Any types of regulatory questions or government affairs needs that folks have, including helping them advocate for themselves in their state chapters through the Home Care Association of America. Our team has lead for that here in Omaha. And we participate in the Home Care Association of America activities, both at the state level through state chapters and also through the national organization headquartered in Washington, where we do have a lobbyist on staff, as well as retaining the services of a professional lobbying firm there in DC.
Hey, awesome. That was a lot to cover, and I cheated. In advance of this webinar, I wrote down a few questions for you that I have teed up, sectioned into a few different areas. So we're going to start with talking about just when somebody joins the Right at Home system. We're going to talk about that initial of how that looks. Then we're going to transition into government relations and advocacy, which is something that you mentioned, and I know you're very passionate about. And then we're going to talk about VA, as you mentioned, and your work around that. So let's start with at the very beginning, knowing that the audience of people that are listening right now are people who are interested in potentially becoming a Right at Home franchise owner. And in the event that you are in a state that requires a license, maybe some tips that you can give to somebody who is doing their research on Right at Home, some general research that they can do on their own online to get a sense of what if their state indeed has a state home care license, and kind of what research and knowledge they need to know even before they join the Right at Home system.
Sure. So Right at Home, for the most part, is a non-medical home care franchise system, providing non-medical in-home care. The advantage of being non-medical means that we are not saddled with all the administrative requirements of Medicare, and our franchisees can be very nimble in their strategy development and outreach in the community because they're not burdened by Medicare requirements. However, states do have, at least 33 states have a license that a non-medical home care agency would need to obtain in order to open up their business and deliver care in the home. And the care that we provide is personal care, hands-on care, also called assistance with activities, instrumental activities of daily living, allowing people to remain in their home over the long term. Whereas a home health agency might just send in a clinician for a short period of time to treat an illness or injury, our caregivers are in the home for many hours every week, allowing someone to get a break from caregiving if they're the family caregiver, allowing the family caregiver to work or to visit outside the home, knowing that their loved one is cared for. So there are licenses to provide those ongoing assistance with activities of daily living needs. So what we would do to help a new franchisee is help them to understand if their state has a license requirement. And if they wanted to do research now, and they can just Google, does my state name require a license for non-medical home care? And I think that's the important thing. You want to specify non-medical home care. And then chances are you'll be led to the page, usually on the Department of Health website, where there'll be an application. There will probably be some instructions. You know, a lot of folks that start non-medical home care agencies are not from a healthcare background, and the state governments know that. So they really kind of, in terms of easy to read and understand, and you can review the application. Now, if a franchisee comes with right at home, then we will introduce them to our vendor that we contract with to help them through that license process. Now, we have understanding of the license process in all 33 states. The vendor has the bandwidth to assist home care franchisees in the right at home system every step of the way, filling out the application with them, submitting it for them, or corrections that the state might have to the application.
Okay, perfect. And I'm going to ask you this question. I know the answer, not quite sure how you're going to answer it, but I'm going to ask it anyway. So it's a frequently asked question that we get, and the question is always, how long does it take for me to obtain my home care license in my state?
On average, most of the home care licenses are in the realm of 3 to 4 months. Okay. There are some outliers around the 5 to 6 month mark, but most of them are 3 to 4 months. And we find that timeline somewhat inconsequential because a franchisee needs to do so much to prepare themselves for success. And we help them through a Right Start onboarding process to achieve that. So there are a number of months that they need to be preparing, learning, interacting with a great army of subject matter experts here at the Right Home corporate location via Zoom from anywhere they are in the country, and learning and planning for that open date. So it kind of matters that it's 3 to 4 months because there's a lot of other things to do along the way.
Okay. Perfect. All right. So I think that I have covered everything that I would like to cover regarding licensure. And for our listeners, if there's any additional information you want on licensure, certainly let us know, and you can type it into the Q&A box there. But I'm going to shift to, and I've just lied, I'm not shifting anywhere because a question just came into the Q&A box.
I see it.
Okay, I'll read it out loud. It says, is it possible that you would ever need more than one license to operate in a given state? For example, if you offer different levels of care, do you need different license levels?
No. Usually a home care agency is going to get the personal care license. That will allow them to do both companion care, which is or just staying in their home, helping with some light household duties, but not necessarily helping them with bathing and dressing, etc. That personal care license allows for those services, homemaker services, as well as hands-on care, assistance with activities of daily living. Then if a home care agency wanted to get a home health license, the home health license would then allow them to provide the personal care as well as the homemaker services. Okay, got it. And I can add to that as well. There's a small percentage of our franchise system that provides what we call specialized nursing services. And it's an additional level of medical care, but it's a very small percentage. As Doug mentioned, the majority of our care is non-medical personal care to seniors and adults with disabilities, with a small percentage of more that medical side of things, which would require additional licensure, and there's additional things that come along with that. So that may apply to that. Like, yes, that's specialized nursing services if you wanted to provide that level of care. Just the standard home care license most of the time would not cover that type of care. Is that correct, Doug? Yes. It's usually the home health license that would apply. Okay, perfect. Here's the next question that just came in. It says, what
to provide business license? Why does it take 3 to 4 months? Any high-level overview of the process that you can elaborate?
So the 3 to 4 month time period really starts when the application is submitted to the state agency that reviews it, usually the Department of Health. And why does it take 3 or 4 months? Because states will receive the application. It'll usually sit in the mailroom or in a queue for a while before a state employee then looks at it. They don't necessarily work that quickly. And then there will be a review process where anywhere from 1, 2, 3 different people or departments at the state will review the application. They will then respond to the application, say a month after receiving it, with a list of additional questions or the next steps in the process. Next steps in the process could include a home care agency owner orientation that the state requires. Or a unique ID to be added to a state registry of home care agency owners. There are a number of different types of activities that the state may require to verify that the person understands what they're doing, that they can be tracked if they, commit some type of crime later on. So all of those reasons flow into why it might be 3 or 4 months. Another ingredient in the process oftentimes is some type of survey action. Now, the inspection could be someone from the state coming to the office where the home care agency is going to be located and reviewing records, reviewing filing cabinets and locked doors and secure files, etc. Or it could just be what's called a desk review, where the state is reviewing policies and procedures. They're reviewing the application. They are having a phone conference with the applicant to quiz them on what they know and understand about the regulations. And I'll say this too about the license process in general. States aren't usually looking to deny someone a license. If you follow the steps to get the license, you will get the license, unless there's some type of disqualifying criminal history. That does not happen for our franchisees.
Yes.
And so the license eventually, if you work the process and you listen to our team and the vendor team about what to do.
Yes. Okay. Great point to make. Thank you for that. And I don't see any other questions that have come in regarding licensure. So I am going to shift gears here to government relations and advocacy. My first question to you, Doug, is how does Right at Home advocate for home care legislation at the state and federal levels?
Yes. So we believe, as a member of the association, we at the corporate level have corporate staff, including myself, that participate in HCOA activities, councils, and committees. So I sit on the Legislative Policy Committee, and that is engaged in both federal and state advocacy, watching legislation, determining what the association's position should be on the legislation, or advising on how to devise comments on a regulatory action at the federal or state level. I also chair the VA Advisory Council for the Home Care Association of America. That's a third issues pertaining to home care agencies contracting with the VA Community Care Network. We provide input and comment to the U.S. Department of Veteran Affairs, as well as the third-party administrators, TriWest and Optum, that run that provider network nationwide. We provide advice about procedures and operations. We provide advice on where there might be a need for additional reimbursement for services. And we are really, that council really is the focal point and the voice for home care nationwide with the U.S. Department of Veteran Affairs. And the VA enjoys having one place to go to speak to the entire home care community. So it really is a privileged position that we have with them.
Yeah.
So that's a little bit about what we do at the corporate level. but we also pay for the state chapter membership in the state chapters for home care, for Right Home home care franchisees. Their state capital. I believe there's about 13 state chapters in various states around the country, usually states that also have a home care license. And those state chapters will have an annual conference. They'll have Zoom meetings. They share insights and information about what's happening at the state capitol. Some of the chapters have lobbyists that are actively lobbying legislation impacting home care. And so we just help you hit the easy button. We pay for the membership. We get you connected with HCOA, add it onto their roster. You get a access to a portal, and you can learn all the things that your chapter is doing and stay engaged with your state chapter. Very, very important to do because you don't want to find out a week before some new law goes into effect that that law was a result of a bill that passed last year that you were unaware of because you didn't participate in state chapter activities.
Okay, awesome. You've jumped the gun. I had what role do franchisees play in those efforts? And you already described that. Thank you for that. I suppose a follow-up question to that would be, can you share like a successful lobbying effort or policy change that benefited our franchisees?
Yes. So in Connecticut, there was a bill to create a home care registry for home care aides. Unfortunately, it's publicly available. And the Home Care Association of America, Connecticut, drew up an exemption for home care aides, basically for any reason that makes the aide feel uncomfortable with having their information publicly available. And so that is something that home care agency owners can use. They complete the form with the home care aide. It gets submitted and it's on file with the agency, and that caregiver is exempt. The only reason that exemption exists is because of that state chapter in Connecticut. That was a heroic, very, very important for caregiver privacy.
Awesome. Awesome. Okay. Thank you for sharing that. And as you are answering that question, a question did pop up. It says, and this is from our last topic, it says, you mentioned we can expect a couple of surveys while state is reviewing your business license application. Do they expect us to open the office before license or during license or post license?
Yep. It depends on the state. So I would say most states don't have a on-site survey. If there is a survey, there's really only one, and it will be at the end of the license process. Some states have an office to conduct the survey because they want to know that the agency has an office. They want to know that records are kept secure. Florida, for example, has an in-office survey. I believe New Jersey does as well. And as far as having the office open, Texas will allow an office to open, and then they state that they could have a survey within 6 months, but they're about 3 years behind. So that survey would come well after opening. So it varies from state to state.
Oh, okay. Well, I thought you said 6, but 3 is still pretty significant. But anyway, okay, thank you for that. Let's see here. All right, so I do want to shift gears, talk a little bit about VA. You mentioned that earlier. And I suppose my general question to you is, how does Right at Home assist franchisees in contracting with, their local VA provider to provide services to veterans?
Yep. So Right at Home developed a close relationship with Optum leadership at United Healthcare in 2019 when the VA Community Care Network was first established on the East Coast and in the central U.S. That relationship has continued credentialing and contracting process with Optum. in regions 1, 2, and 3 of the VA Community Care Network. And anyone listening can Google VA Community Care Network. They can see the map there of regions 1, 2, and 3. Region 4 was established by TriWest and their network of providers, and that started in late 2020, early 2021. And as we worked with Optum, so then we took those credentials to TriWest and established a relationship with the TriWest leadership, and we have an understanding of that contracting and credentialing process as well. So the VA contracts with Optum in the east, TriWest in the west. Optum and TriWest have the contract that providers complete to join the VA Community Care Network. We have staff here at the corporate office that understand those processes, have regular interactions with Optum and TriWest leadership. So again, as long as we work the process, then eventually a home care agency would be able to get a contract. Now, I will warn this audience that network is fairly mature. As we said, it was open in 2019 in regions 1, 2, and 3, in 2021 in region 4. And the reimbursement rates are good. And so that attracted a lot of home care agencies to the network. And so it's very mature at this time. And most areas of the country have all the home care agencies that they need right now. However, if you come with Right at Home, we have secret tricks of the trade to try to advocate for you and put you in the position to get into the network as soon as possible. It could still take a year, 2 years. There are certain things that we can do to assist you to give you a better chance of getting that contract sooner rather than later.
Okay, perfect. Thank you. A question came in. I'll read it to you. It says, are there any government regulations that prevent home care agencies to do placement services into senior care homes or assisted living facilities?
So that would be a staffing agreement where your caregivers that are employed by the home care agency are going into the facility to provide care to the residents. And no, there aren't any regulations that I'm aware of that prevent that. We do have franchisees that do that. There is some concern among franchisees about doing that because sometimes the facility will make a job offer to that caregiver, or that caregiver gets attached to some of the residents, and then they want to work for the facility instead of working for the home care agency. So we have business coaches on staff that have understanding of how to navigate that, things to think about so that you understand how that really should work.
Okay, perfect. And then shifting back, we already talked about VA. You mentioned something earlier about Medicaid waiver as a potential option. Can you talk just a little bit about that?
Yeah, so Medicaid waiver is a vehicle to provide health care to those that are below, usually around 400% of the federal poverty level in the states. It is funded both by the federal government as well as state governments, but then it is administered by the state. The states determine the eligibility criteria. The states determine the benefit packages, which could include home care, and then the federal government provides matching funding for many of those benefits. So it's jointly funded, but the state runs it and determines eligibility and benefits. Home care, or in Medicaid speak, home and community-based services, HCBS, are the home care services through Medicaid programs. And in every state except California, those services are run through home care agencies. We find generally that there can be more cancellations of services by clients, schedule changes, unsanitary, unsafe conditions in a lot of Medicaid waiver cases. So it can be challenging for that reason. It can be challenging because of the administrative burden, because of regulations like electronic visit verification to clock in, clock out on a particular device or app. for Medicaid billing purposes to prove that services were rendered as you said they were. And that would be in addition to any scheduling that you might have with the agency. And then also payment. The reimbursement is not great in most states for Medicaid waiver. There's maybe about 7 or 8 states where we have an appreciated Medicaid waiver in those states. And some of our franchisees have been successful in working with their H2A state chapter to advocate for more reimbursement or for better processes for Medicaid waiver in their states.
Okay, perfect. Thank you for that. And I'm flying through my questions because we're run out of time. You mentioned the guide program earlier. Can you explain to our listeners what that is?
Yes, very exciting. So this is the first time that Original Medicare is providing a in-home care benefit, well as a number of wraparound supports to help those with dementia in Original Medicare and the family members that are caring for them. CMS, the Centers for Medicare and Medicaid Services, runs the guide program, and they know that those with dementia and the families supporting them are really struggling. So guide is a Medicare benefit for those, again, with original Medicare and dementia diagnosis. It provides 72 hours a year of respite care or home care. It provides a 24/7 helpline to a clinician with dementia experience. It provides family caregiver training to help them to understand how to manage their emotions, as well as understanding what's happening to their loved one, care coordination with other providers. Medication management is also a benefit. And there is a guide group that delivers all these benefits at no cost to the home care recipient. So we have home care agencies contracted with guide groups to provide the respite care, and I help them get those contracts.
Okay, perfect. Thank you for that. Which I agree. It's super exciting and something that we're so incredibly proud of, and just an exciting addition to more services that we can provide to seniors and adults with disabilities. Question that came in here, it says, and they're leading with this, not sure if this is accurate or not, is VA care now capped? VA care is capped now and no longer accepting new agencies.
Right.
Are the new franchisees still allowed to apply for VA?
Getting to that provider density issue that I spoke of, the VA network is very mature. And so in a lot of places, you would be on a wait list for a contract in regions 1, 2, or 3 with Optum. Region 4, Tri-West, will allow you to get a credentialing application submitted and contracted, but then there may be so many providers that there aren't any referrals available to you at that point in time. So is it capped? No, not necessarily. We can work with you to eventually get some referrals or get into the network, but it will.
Awesome. This has been super informative, packed full of information, absolutely relevant to our audience. And before we wrap up here, is there anything that we haven't covered today, that we haven't talked about today, that you feel our audience needs to know in the event that they decide to move forward with becoming a right-at-home franchise owner?
I really thought you'd have a question about the government shutdown. That does not affect.
I don't want to talk about that, Doug. It's going to be over tomorrow.
That does not affect home care payments for VA and Medicaid or guide. In fact, much of the government continues in operation as it normally does.
Yes. And just to put a timestamp on Doug's comment there, today is Tuesday, October 7th. The government has been shut down for about a week or so at this point.
7 days.
And you're right. We have no idea if this is going to end, in the next hour, or if it's going to be several months. There's really no way to anticipate when the end is near. But I'm glad that you mentioned that our business carries on as usual. And for the most part, no impact on and right-at-home franchisees. Is there anything else that you'd like to add to people who are watching this and considering becoming a right-at-home franchise owner?
I think just give us a call and let us talk to you.
Okay, awesome. All right. Thank you so much for this. This was super informative. I so appreciate you taking the time to do this. I know that you're a super busy guy. I appreciate you, and I know our listeners do as well. So thanks so much.
Thanks, Jen.
Okay.
Thanks,
Have a great
everyone.
day.
Bye-bye.